Today's webinar is an introduction to gaitACTIVE. You're going to hear about our new program, and it's about transforming gait rehabilitation and driving clinic revenues. That's what we're going to spend the next 30 minutes or so talking about. We'll leave plenty of time for questions and comments. The chat is open so that if, as our presenters are speaking today, you've got any comments or questions, feel free to write them in there, and then at the end, we'll get to them and we'll answer them as best as we can. I would like to introduce our three presenters today. First of all, we're going to have Hilik Harari, who's gaitBetter's CEO and co-founder. He'll be giving an initial introduction to the company, giving you some background. Then you're going to hear from Sagi. Sagi is our product manager and clinical leader, and he'll take us through the program and give his clinical background and the kind of what underpins the program and our technology. And then Ruth Greenberg, who's our Director of Business Development, will talk about the business side of this, how this structure works of the program, how it can be applied in your clinic, how the financials work, and really take you through that. And after then, we will get on to Q&A. So that's the agenda. Hilik, Sagi, and Ruth, in that order. Each of them will speak for maybe 10 minutes or so, and then we'll get to the end. So thank you, everyone, and I'm now going to hand over to Hilik.
Thank you, Darren, and thank you, everybody, for joining this call today. And we're really excited about the new program, gaitACTIVE, a fall prevention program that Sagi will elaborate on, which was just recently, a couple of weeks ago, was approved by the National Council on Aging as an evidence-based health promotion program, and I will elaborate on that later on. I always like to start with falls and keep reminding all of us, you know the statistics, they are horrible. About almost 30% of the older adult populations will experience a fall at least once a year. And we know that as we age, you know, when you reach 70 and 75 and 80, that your likelihood to experience a fall is just getting worse. Add to that about 20% of those falls result in an injury that requires medical attention. Unfortunately, even through COVID, falls continue to be the #1 reasons for death and injury out of that. One of the things that was developed over the last 10 to 15 years, I would say, is the relationship between cognitive decline, specifically as it relates to executive function skills and walking abilities. And hundreds of researchers have shown that time and time again that as we age, we suffer from other neurological conditions, and our cognitive skills, again, specifically related to executive functions such as working memory, attention capabilities, reaction time, and these type of skills decline, it will affect our gait and often will lead to falls. However, when therapists are trying to implement motor cognitive therapy, meaning that implementing training that involves both the cognitive side and the physical motor side in the same time, using conventional method, we're often very limited. And that's because it's really hard in a setting of a clinic to resemble real life situation. The training is often would be limited in duration and intensity, and we know that we need to get that intensity in order to see better results. And eventually, it is a subjective and I hate to say sometimes boring type of training. And this is why we've developed gaitBetter. And Darren, if you can move to the next slide. gaitBetter, as some of you are already familiar with, it's an innovative technology. It's an add-on to existing treadmills. So we're not in the business of selling treadmills, but rather augment your existing equipment with the virtual simulations. We present simulations added to your treadmill training. And by doing that, we enable personalized motor cognitive or dual task training. And we've seen that that type of training significantly improves gait, balance, dynamic balance. It helps and improve cognitive skills, and eventually it leads to a significant reduction in number of falls in reality. Let's see a quick 90-second video that will give you a very good sense of what gaitBetter is and the tool that we're using for gaitACTIVE.
By adding virtual simulation to any treadmill, gaitBetter enables motor cognitive intervention, enhancing gait rehabilitation outcomes and reducing fall risks. The supportive harness system ensures safety and builds confidence, allowing patients to focus on their rehabilitation session. gaitBetter's intuitive dashboard allows therapists to tailor each session for the individual patient. Build patient confidence with engaging motor cognitive training. Real-time feedback allows clinicians to monitor progress and adjust therapy to meet individual needs. Experience greater patient adherence and outcomes thanks to highly engaging multi-game options. The dual tasking approach is ideal for treating gait impairments, including neurological, orthopedic, geriatric, and other conditions. Experience the future of gait rehabilitation with gaitBetter.
I want to share with you that, and again, some of you may already have seen that and may have read some of those papers, but gaitBetter was tested time and time again. We've concluded 8 clinical trials. Some of them are very large ones with hundreds of patients. We have actually, we need to update that slide. We have 23 peer-reviewed publications, and then actually the 24th is already out for review and hopefully will be published in the next few weeks. So concluded 8 clinical trials. In all of them, we've shown that that type of a training using the gaitBetter system significantly improve outcomes. In one of the studies that we've done, we've reached more than 70% fewer falls in the 6-month post-intervention. That study included 200 adults. And almost 50% reduction in ER visits due to falls and falls injury. So the technology is a solid technology, and it's already been adopted by many, Darren, if you can move to the next slide, please. It's been already adopted by some of the leading providers in the US and in other places. It's been adopted in different type of organizations because the system can be very easily adapted to different functional levels of patients. So we see it in inpatient and mostly outpatient in large organizations like Burke and Ochsner and Henry Ford, Spalding, of course, New York University Langone are treating stroke patients with gaitBetter. We have several VA clinics that are using that. And obviously private physical therapists as Physical and others. And we also serve assisted living communities like Goodwin and Christian Care and many others. So great technology was proved from a science perspective, already been adopted by many providers. We've seen well over 15,000 patients, our system did. And with that, I will transfer to Sagi that will walk you through the gaitACTIVE specific program, which is tuned for fall prevention.
Thank you, Hilik. Yeah, thank you. So again, my name is Sagi Gitterman. I'm a director of product and customer success, and I'm also a physical therapist by training. So when we think about gaitACTIVE, we're not talking about a gadget or another shiny tool. This is a program. It's built on the reality that walking is not just a motor task. It's a motor cognitive task. And if you've worked with older adults, you know this intuitively. Think about your patients. Some of them can walk in the clinic with you, focused, maybe even confident, but outside, they're carrying groceries, scanning for cars, or answering grandchild's questions. That's where the fall happens. That's where independence is lost. gaitACTIVE, advanced cognitive training in a virtual environment, is designed exactly for that moment. It's walking combined with thinking, reacting, planning. It's real-world practice in a safe setting. And the kicker, as Hilik mentioned, it's not just our opinion. The National Council of Aging recognized it as an approved evidence-based program. That stamp means that the data is solid. This reduces falls. So when I explain gaitACTIVE, I don't say it's a treadmill add-on. I say it's a smarter way to train walking, the way our patients actually live their lives. Devin, next slide, please. So why is this the answer to what we face every day as clinicians? First, practically, gaitACTIVE is an add-on to treadmills we already use. No need to rebuilding gyms and no need to purchase massive equipment for footprints. Second, it's built on gaitBetter technology, which makes it reliable, consistent, and therapist-friendly. We don't need to reinvent how we run a session. It fits into what we do. But here's the real value. It's purpose-built for older adults and the patient with many gait limitations by several conditions, neurological or orthopedic. This is not a general fitness software. It's designed around the needs of seniors who have balance issues, cognitive decline, or fear of falling. It's a clinical program that respects the realities of our population. And finally, it's easy to implement. From the therapy side, it takes a little time and really easy to set up and run a training. From the manager side, it creates a new lines of service. And when you can say to your community, we have a structured evidence-based fall prevention program, that's a powerful statement. It can attract patients, it can reassure families, and it can position your clinic as a leader. Next slide, please, Darren. So what sets gaitACTIVE apart is that it's not random or open-ended, it's structured. We run it as a program, 6 to 8 weeks, 12 to 15 visits, usually 2 to 3 times a week, 30 minutes each. That's a dose we know the patients can commit to, and it's enough repetition for motor cognitive learning to take hold. And importantly, we measure. Every patient gets pre and post assessments. We can test gait speed, balance, task ability, cognitive function, fear of falling. It really varies depending on the patients, but we measure, and that means that we're not just saying you look better. We're showing them progress with data. That's motivating for the patient, and it's gold for us when we report outcomes to families, referrals, resources, or insurers. The session flow is also familiar. So inside the session, the patient is wearing the harness, doing the warm-up, and then practicing between usually 2 to 3 walking blocks or bouts with different cognitive tasks and games, and then cool down. So usually the recommended dosage is around roughly 10 minutes per trial. So the patients will practice in each session between 2 to 3 trials, walking blocks. Of course, if they can walk longer, they can do one longer walking trial, or if they can in a lower functional status, so we can split it up and break it to shorter trials and longer resting periods. It mirrors what we already do, but it's add a layer of cognitive challenge that mimic real life. As Hilik mentioned, safety is central. We use a harness, we control the treadmill speed, and progression is AI-based, but always under therapy supervision. We can always customize every element of the training. That means the patients are safe to push limits without fear. And here's the magic. The patient actually enjoy it. They'll tell you, this is feel like a game. And that enjoyment drives adherence, which drive results. So gaitACTIVE is structured, effective, and efficient for us and for our patients. Next slide, please. So when I say this program is for seniors, I don't mean a narrow slice. I mean the wide range of older adults we see every single day. Think about it. The patient with a history of falls, maybe once, maybe multiple times, but every one of those falls is a marker for risk. Those patients living with fear, they haven't fallen yet, but they stopped going outside for walks, they stopped going with friends to restaurant, or they sometimes cling to the walls at home. That fear becomes its own disability. The unsteady walkers, they slow when they're turning, they sometimes stop or hesitate when distracted, or even freeze when something happened in the environment and it changes. Inside, of course, you have the neurological patients like stroke, Parkinson, cognitive decline, multiple sclerosis, TBI, and else, where attention and gait are deeply intertwined. The orthopedic patients like joint replacement, fractures, surgery, arthritis, pain, amputees, and of course, the post-rehab graduates, those who finish physical therapy after surgery or hospitalization, but still are not confident enough to go back home and leave it alone. These are not edge cases. These are our daily caseload. gaitACTIVE speaks to them all because what they share is the need for safe, structured, motor cognitive training that prepares them for real life. Next slide, please. So what you can see here in the slide is the strengths of evidence today. We've moved past single-site trials. We now have systematic reviews and meta-analysis confirming that dual-task training consistently improves gait, balance, and reduce falls. This is not just a nice idea. It's a proven approach across multiple studies. For a specific population, the findings are just as strong. In Parkinson's, treadmill training combined with a cognitive load improved both walking speed and executive function. In older adults with mild cognitive impairment, VR-based training reduced the typical drop in performance when walking and thinking at the same time. These are exactly the patients we see in our clinics every day. And importantly, dual-task training is no longer stuck in research labs. Programs are being adopted worldwide in rehab and wellness settings because they don't just improve gait, they reduce frailty, enhance executive function, and improve overall well-being. The study that really sparked this field, as Hilik mentioned, and directly inspired gaitACTIVE was the V-Time trial by Mühlmann that was published in The Lancet, who showed 42% reduction in falls using treadmill and VR cognitive training compared to just walking on treadmill alone. It was the first to prove that if we want to prevent falls, we have to train both the brain and body together. So when we look at the evidence today, from V-Time to most recent reviews, the message is clear. Dual-task gait training works. It's effective across conditions, and it's becoming the new standard for fall prevention. Next slide. So let's hope the videos will run properly. But in these videos, you can see 3 examples. The left video, you can see more independent living in the community patients. Some of them need the support of the safety harness, while some of them not. They're doing gaitACTIVE as a fall prevention, general wellness and well-being program, which they're coming in the dosage that we talked about. At the center video, you can see more low-level patients in rehab or post-rehab settings. They may need more support, they may need more customization, but the goal and the training is the same. And on the left video shows how gaitACTIVE program was implemented in an amputee rehab program, post-prosthesis, in an outpatient clinic in Germany. And that's the beauty of gaitACTIVE. It's adaptable. We don't need to select only the high functioning or only the frail. We can start where the patient is, supported, harnessed, slow speed, and progress them toward independence. Every patient has the same goal: safe walking, reduced fall risk, improved confidence. The pathway maybe look different, but the destination is the same. Clinically, it means inclusivity. No one gets left out. And practically, it means you can offer this program broadly to your community, knowing you can scale it to fit the individual. It's motivating for patients, it's satisfying for us as clinicians, and it's reassuring for families who want to see progress without fear. I think you can move to the next slide. So that's why gaitACTIVE works for our patients and for us as therapists. Ruth will take it from here and show how clinics are actually putting this into practice.
Thank you, Sagi. Okay, so good afternoon, everybody. Really do appreciate you taking your lunchtime and spending it with us. So a couple of things we're going to touch on here, some of which Sagi, I think, did an excellent job of covering already. So first of all, we think about differentiating your clinic. One thing we know about the PT world, whether you are a CCRC or you are a private clinic or an outpatient or inpatient, we are always looking to differentiate our clinics, right? There's plenty of them out there. There's a lot of competition. We are all trying to take care of our clients, run a healthy business, because every medical person in the world who's trying to support our community is also trying to run a business. If we can't support you in running a healthy business, it's much harder for you to bring in new technologies and support your community in that way. So by bringing in something like gaitBetter to enable you to do the gaitACTIVE program and other cash pay potential programs within your community and within your clinics, it really gives you an opportunity to brand your clinic that you are embracing new technology, that you are offering best-in-class motor cognitive training solutions, and that you are suited for multiple indications and conditions. And I think Sagi covered that really well, that one of the things to remember is that this fall program and the gaitBetter in general are really going to support a large swath of your patient base. And that's really critical when you make an investment these days, something you always want to consider. So now you can stand out from the crowd and you can invest in what's best for your patients and community. Increasing session frequency and retention. This is another place we don't really think about, or maybe you do, but I want to highlight, which is that many of our patients come in and maybe they finish 80% of their prescribed sessions. We want them to finish 100%. If we can include higher engagement, really getting them to enjoy the gamification, the competitiveness, the instant recognition. When you do a gaitBetter session for your program, you are able to see what are you scoring, how are you doing. All of these things make this much more engaging to the user, which keeps them on the machine longer, working harder, and always coming back for more. And that's what we want. So you get that additional revenue from completing sessions from an insurance perspective. But then we also have to look at it from a wellness and a cash pay. So I guess if any of you'd like, you can put a note in the chat room. If any of you are currently running either wellness programs or cash pay programs of any kind, I'd love to see what that is and be able to review that with you and see how we might be able to support and fall in with that. So wellness programs, right? We know that right now increasing wellness in older adults is critical. We have longer living patients. 40% of our population by 2050 is going to be over 65 years old. So we're really looking to improve. So whether you are using gaitACTIVE as your new wellness program or you want to incorporate it into existing wellness programs, these are options for you to consider. So when we talk about attracting cash pay clients, right? We have fall prevention, as we talked about. Another one that we see a lot is the LSVT Big program, which is a great program for servicing patients with Parkinson's. And the gaitACTIVE program is an excellent follow-up to continue that treatment and that training. Continuing re-education post-rehab, when they complete their sessions, the gaitACTIVE program is a great opportunity because we know that roughly 80% to 90%, if we're lucky, is where a patient hits before they are released from rehab from an insurance perspective. So moving them over to the gaitACTIVE program will really give you an opportunity to bring them to 100%, to bring your reputation as a clinic just to greater heights, and to have a revenue program. So pre and post surgery exercise for weight loss and preparation for surgeries is another area where the gaitACTIVE program can also be quite helpful. Next slide, please. So let's talk about this clear pathway for growth in numbers. So here you see that what we're giving you is an example here. So as Sagi talked about, we look at 15 sessions per participant. I choose $20 here because that's a pretty good average of what somebody's paying for a copay. So we know that it's a price they can bear. Now, if you're in a more high-end community, by all means, if you have other class pay services and you're offering them for $30 a session or $40, that is your option. But for us, we're just going to start with $20 because we feel like that's a fair average to look at across the board. So if you have one patient a month who decides to come in and sign up for the gaitACTIVE program. That's going to be $300 for that patient. So we know, and we're getting that number, $20 per session, 15 sessions, $300. So once a month, 12 months out of the year, your expected revenue is $3,600. If you bring in 2 patients a month, that's one every other week. That's 30 minutes of your PT's time, 1 day a week or 2 days a week. You are going to break even, which means you are going to pay for a year of gaitBetter right there. Your subscription is done. If you get to 3 or 4, here's where we really start to make income, right? Because you're seeing here's 4 patients a month. That's 1 new patient a week. It's going to bring you to 10,800. So we see the growth and the trajectory. This is a great way to bring cash into your clinic. It's a great way, as we talked earlier, about branding your clinic. You have a broad group of patients you can talk to, and there's also places out in the marketplace to connect. So this is where you want to make sure that you are talking to the geriatrician specialists in your area and letting them know that you have gaitBetter and the gaitACTIVE program. If you're a CCRC, this is a great opportunity for you when you think about when you have one part of the couple who is in independent living and maybe the other one is starting to slow down. Maybe they have Parkinson's, any of these. They can go to your senior center and your wellness center, and now they can participate in the gaitACTIVE program there. Maybe you have a PACE center and you want to bring them there. These are all different areas where you can look at using gaitACTIVE as part of your clinic and offerings. Another way you can look at it is if you are a clinic, you can go out and visit your CRCs and your 55 plus communities, and you can share with them. So there are lots of different avenues for you to go out and introduce gaitACTIVE as part of your offering, as well as letting them know that you offer the gaitBetter system for rehabilitation. Next slide, please. So we at gaitBetter feel it's very important to partner with our clinicians. It's something I've always believed in. I've been working in the medical device industry for 15 years, going out and selling and partnering with our clinics. It's very important that we help you. You are patient first. We are product first to make your patients better. So we help you with marketing to support you. So we have handouts that you can share with your clinics and with your on your marketing efforts. We have loyalty cards that you can utilize. You keep them at the front desk to keep track of how many sessions your patients have completed to make it easy for you. We have mobility cards that you can hand out, and we have a gaitACTIVE implementation program that takes you through step by step with the support of Sagi and myself to ensure that we get you up and running in a healthy and successful program. We are not here to give you an idea of a program and walk away. We are here to support you and your team from setup to implementation and success. It's critical. So, as I said, it's more than a session, it's a partnership for us. So if you have any questions, we're going to go through that next. I will let you know that in a few states, not all, we do have some reimbursement coming through, but that I would definitely prefer to talk to on a one-on-one basis because it is individual by state. So overall, our key takeaways. gaitACTIVE is an evidence-based wellness and fall prevention program. It utilizes your existing treadmill. It improves engagement and retention, reduces no-shows, and ultimately enhances patient outcomes. And that is what we all want. And it boosts clinical revenues. So this is the package that we are offering, and we are here to partner with you. Other than that, I want to thank you all for your time, your consideration, and your interest. And now we will go back to Darren, who will handle any questions you may have.
Thank you, Ruth, and thank you, Sagi and Helik before for going through all of that. I know we're just gone over the half-hour mark, and we're conscious of everyone's time. So if anyone has any questions, you can raise your hand and I can unmute you, or you can share those questions in the chat. I can read them out. Any questions or comments from the attendees? Thank you, Tyrone. Tyrone says, it looks great, wonderful presentation. We're going to be sharing the presentation with all of you here today and with everyone else who registered who couldn't make it. We'll be sending that through, and you can feel free to then get in touch with us directly. I will share on the presentation that we send out. There's a general email address, but actually we'll add on to that email addresses for myself, for Helix, for Sagi, and for Ruth, so that you can get in contact. Okay, we have a couple of questions. Leah is asking, are there standard ways to progress the dual tasking components? Is there a standard way to progress and measure progress? Sagi.
Yes, Darren. Sorry, can you repeat the question?
Yes, Leah is asking, are there standard ways to progress the dual tasking components? Is there a standard way to progress and measure progress?
So there are not really a standardized measure that you can progress. So you do have like the options of time up and go and dual task time up and go when you ask the patient to count backwards or any other task that you combine with, and then you can see some effect. Unfortunately, we don't have enough, or even I will say even at all, standardized ways to measure and progress like the clinical tests that we know. But the gaitBetter system does provide like a progression report for the patient that you can track the progress in perspective of the trial duration, so the walking duration, the walking distance, the walking speed, and of course the success in the motor cognitive elements, so the level of the obstacles and the success level of crossing them, whether it's the right leg or the left leg, and the success in the cognitive addition. And this can give you some good picture about the motor cognitive performance, and it's measurable, so you can really see it like progressing. I hope this answered your question.
Thank you, Sagi. Susanna wrote, thank you, Susanna. She will follow up with us, so thank you. We'll also be in touch. Anna is asking, we don't have an attachment for the harness. Can you help with that? We certainly can, Anna. We can help with the attachment, the bridge, the safety bridge, and the harness itself. So we'll get in touch with you, and we can discuss the options for that. But we can supply everything required for you to get going. And we have quite a lot of experience either supplying with our bridge and harness or working with an existing bridge that somebody may have, either as a freestanding bridge or sometimes a bridge which is connected and rooted in the ceiling, in the clinic ceiling. I want to thank everyone for taking time to attend today. I said, I'll repeat again, Wednesday, 1 p.m. Eastern in the afternoon is not often ideal, but trying to find times that fit for everyone. But we really appreciate that you joined. We're going to share the presentation, as I said. Please feel free to get in touch with us if you have other questions or feedback or comments. If you'd like more information, if you'd like a one-on-one chat with one of our team to really get into the details of the program and how it might be suitable for your clinic or senior living facility, we're here to help and answer as many questions as possible. And with that, I will thank everyone. Enjoy the rest of your day, and we hope to be in touch with everyone soon.